leaders, heads of ministries, departments, and agencies, civil society leaders, development partners, distinguished ladies and gentlemen. Let me welcome you all to the formal launch of the PHC Leadership Challenge today, the 17th of August, 2022. I'd like to also welcome our partners and friends in the private sector for working together with us on this journey. As the popular saying goes, if you want to walk fast, you walk alone. But if you want to walk far, you walk together. And we hope to walk far and sustain this initiative as we work together. Today we're pleased to restate our commitment as governors to building a resilient primary health care system. As evidence has shown that primary health care has the potential to expand attainment of universal health coverage to as much as 80% of the population. As part of our enduring partnership with the Bill and Melinda Gates Foundation and Aliko Dangote Foundation, we convened a roundtable on 12th and 13th November 2019 in Seattle, United States of America, to reflect on the state's government's development agenda for immunization, primary health care, and human capital development. This culminated in what is now known as the Seattle Declaration, which restates the commitments of the Nigerian Governors Forum to strengthen leadership and accountability for the primary health care system at the state level. Yesterday, the National Bureau of Statistics launched the MICS and ICS results, and it is gratifying to note improvement in some of the health indices, such as immunization coverage, which increased from 33% to 57%. However, we know, looking at the details of that NBS survey, that much still needs to be done to achieve the desired results, especially in the areas of human resources for health, financing, and stewardship. The Primary Healthcare Leadership Challenge aims to address these bottlenecks as it strives to build a resilient public health care system. On our part, the Nigerian Governors Forum, representing the 36 states of the Federation, has taken up the challenge. We have done it in the past with polio eradication, and we're ready to do it again for primary health care system strengthening, especially given our recent experience with the COVID-19 pandemic. Finally, I'd like to thank our traditional leadership, civil society leaders, the Bill and Melinda Gates Foundation, Aliko Dangote Foundation, UNICEF, the Nigerian National Primary Health Care Development Agency, and our own secretariat at the Nigerian Governors Forum for putting together this challenge. We also thank the Honorable Minister of Health for chairing the steering committee of the challenge. We'd like to call on our other partners to also join in this laudable initiative as we strive to promote exceptional leadership, build a resilient primary health care system, and achieve the best possible health outcomes. On this note, I'd like to formally open this meeting and thank you all for your attendance and eventual deliberation. Thank you. God bless you all. To strengthening primary health care system in Nigeria. Following the endorsement of the Seattle Declaration by the 36 governors of Nigeria in November 2019, the Nigerian Governors Forum, representing the 36 states of the Federation, hereby affirm our commitment to strengthen the primary health care system in the country. We therefore adopt and confirm our commitment in line with the Seattle Declaration as outlined below. 1, improving the governance of the primary healthcare system at the subnational level by fully implementing the primary health care under one roof policy and providing active leadership for primary health care through regular engagement with relevant primary health care stakeholders and quarterly primary health care performance review at the State Executive Council meetings. 2, to promote progressive increase in primary health care funding by ensuring efficient budgeting that is aligned to annual operational plans, promptly releasing approved budget to the State Primary Health Care Board and primary health care facilities, and ensuring that there is a mechanism in place for basic healthcare provision fund implementation and oversight at the state and facility levels. 3, recruit requisite health workforce to ensure that all primary healthcare facilities have the minimum staffing requirement appropriate for their level in line with the state's minimum service package. 4, institute a culture of use of evidence for decision making by ensuring that the data quality across all primary health care facilities is progressively improved. And 5, develop a state-led and state-owned local government area levels primary health care leadership challenge for local government area chairmen for sustainability and strengthening the commitment of the local government area chairman to primary health care. Signed the 17th day of August 2022. Thank you.